Hey everyone, this is Dr. Boyd. Welcome back to Parently. Today we're going to talk about a great question. How do I know if I'm pregnant? Now, it seems such an obvious question, but it's a frequent question that I get asked as an obstetrician gynecologist. How do you know if you're pregnant? Well, obviously the simplest way is to do a urine pregnancy test. Now, this is always confusing for women because they want to know when I should do this. The hormone that is trying to be identified when you do a urine pregnancy test is the hormone HCG, human chorionic gonadotropin. That hormone is released into your body after conception occurs. So the fertilized egg from the sperm, when it ends up in the fallopian tube, starts releasing HCG. And so that first 7 days that conception occurs, even though the fertilized egg is in the fallopian tube, we can still identify whether you're pregnant or not. With an HCG of less than 35, the pregnancy test will be negative or inconclusive. So you have to have a level of 35. So if you think you might be pregnant, then check your pregnancy test 2 days later. Approximately every 48 hours, the HCG doubles. So let's assume you get pregnant. On the first day or so, your HCG is 2, it doubles to 4, to 8, to 16, to 32, and then 64. So around 5 days approximately, 6 days at the most, maybe 7, in a fertilized egg situation, you should have a positive urine pregnancy test. Now, some women with histories of ectopic pregnancy, they and we as providers want to know as soon as you get pregnant. And so in that scenario, sometimes we do a blood serum pregnancy test. Okay, so we have you come to the office or the hospital, we draw a blood test because I want a number. I want that number that I was talking about. A urine pregnancy test just gives you yes, I'm pregnant, no, I'm not pregnant, but it doesn't give you a value. A serum blood pregnancy test tells us a number, and we use that number and make sure that it's doubling appropriately every 48 hours, and that helps us identify if the pregnancy is viable and whether it's extra or intrauterine. Extrauterine pregnancies, in other words, ectopic pregnancies, oftentimes you won't see that HCG number double, and that helps us identify if you have an ectopic pregnancy. The other thing that I want you to just pay attention to is how you feel. Many women, and I would say most, feel different when they're pregnant. They talk about, my breasts feel larger or more tender. I feel nauseated. I feel extremely fatigued. And some women just feel pregnant. They know when they're pregnant. So pay attention to your body. Sometimes those are just as helpful as knowing a urine pregnancy or a blood serum pregnancy test level.
Thanks for watching. Help get this video in front of other women by clicking the thumbs up button if you found this video helpful.
If you like our content, then make sure to click the subscribe button and also ask questions in the comment section below. See you in the next video.
Got it.